Today, I'm hoping to learn more about the behavioral and psychological symptoms of dementia. I really want to learn more about the kinds of behaviors that people living with dementia might experience in the middle stage of the disease. We're spending time with Jeannine Chemello. Jeannine is a registered psychiatric nurse, and she works with continuing care staff and residents to come up with positive solutions for changing behavioral symptoms. Thank you so much for coming over to visit today, Jeannine. I wonder if you could tell us what sort of behavioral symptoms a person with dementia might demonstrate.
Some of the really difficult behaviors with middle stage dementia are the agitation, the aggression, and depression. Somewhere around 75% of people with dementia do develop some of these behaviors.
Oh, really? And well, what are some of the less common symptoms?
Less common would be like the wandering, the sexually disinhibited behaviors, psychosis, and sometimes things like repetitive behaviors like vocalization or actions.
Now, Jeannine, I know you work with people every day to help come up with solutions to behavioral symptoms. Can you tell us why it's so important to take a positive approach?
Positive approach as a caregiver is so important because that helps to possibly lessen those behaviors from becoming a big issue. And a positive approach from a caregiver really helps the person with dementia maintain their dignity and their autonomy as much as possible.
Now, I know it must be so difficult for people in the moment to understand why someone's getting agitated or aggressive. Can you help us understand what the behaviors mean?
You know, if we knew what those behaviors meant, it'd be so easy to treat them. But often we have to become a detective. The first thing I really need to stress is that you need to rule out anything physical. Oftentimes behaviors are related to something physically going wrong in the body. Other times it's just learning a different approach and trying something today and trying something different tomorrow and ruling out step by step what's happening. Behaviors are often, people with dementia are often regressing in their abilities, and sometimes we're asking them to do something they're no longer able to do, and so we have to be careful on how we're asking them to do something.
Sure, that makes sense, yeah. Now, it must be so stressful for people in the moment. Can you give us an example of how we can respond to these situations?
I've got an excellent example. A gentleman who was a salesman. All of his life did business on the phone. And that's how he communicated everything. Phone, phone, phone. He developed dementia. And with his dementia, he started to misdial the telephone. So he began calling the wrong numbers and it became quite an issue. And so his phone was taken away from him. And when the phone was taken away, his agitation escalated to the point where they really had difficulty dealing with what was going on. And so the team got together and put a care plan together. And what they did was he now would go to the nurse and ask to use the phone because his was gone. And the nurse would say that his was broken. And so, but you can certainly use my phone. And so she would dial his wife's number. And he would get to have a conversation with his wife, which totally calmed him, settled his agitation, and there was no longer an issue.
That's a really powerful story. Thank you for that. Makes me understand that we have to look at things from the person's perspective. So can you talk about some specific strategies that we can use to respond to these situations?
It's approaches. It really, truly is different approaches. And you have to ask who's having the problem with the behavior that your family member is exhibiting. So if the person with dementia is pacing, who has the problem with the pacing? Me as a caregiver or the person with dementia? And so if the person pacing is starting to lose weight or becoming exhausted, obviously they have the issue with it, and we as a caregiver need to look at ways to help them to get the care that they need. If me as a caregiver has a problem because my family member is pacing and bumping into things and I'm getting frustrated, it's a completely different answer on how we're going to manage that or how we're going to deal with that issue.
Of course. So not all behaviors are actually a problem for the person living with dementia. So what if the person's hallucinating? Do you have any advice about that?
Let me give you an example.
Okay.
Lady with dementia was hallucinating, and every day after lunch, her routine has always been lay down after lunch and have a rest. All of a sudden began hallucinating, and there's kids on her bed, and they're jumping on her bed, and she loved the children, but she wants to go and lay down and have a rest, and she can't. And so as a team, we got together and we put into place where someone would go into the room and say, okay, kids, everybody's got to leave now, you know, need to rest. So the kids would all leave. She would lay down, have a rest, and when she got up after her rest, the kids all came back, would jump on the bed, and she would be fine. So what the staff were doing is they were entering her reality. Instead of saying, you are hallucinating and becoming upset and looking for a medication to manage a hallucination, they validated her. And they heard what she said. You're seeing kids jumping on the bed. Let's see what we can do to help you still have the kids in your room because you enjoy that, but also get the rest that you need. And so they entered her reality.
I like that, entering into her reality. That's really good. It really makes me see it's from their perspective, and that'll help. Thank you. So what are some other examples of how we can work through these situations?
Looking at things certainly from the person with dementia's perspective is very important. So when you're interacting with them, you want to be face-to-face. You want to be kind and use a slow approach. Don't give too much information at one time. And don't be distracted. Don't have a lot of outside noise going on, the television, you know, the dishwasher and all those kind of things. The more noise, the more distracting it is, the more agitating it can become. So kind, slow approach is really important. And pay attention to things like nutrition, rest, and exercise. Those things can exacerbate behaviors. And so you want to make sure that those things are always looked after.
Those are some great ideas. I see that staying on top of things can really make a difference. So what about the physical environment? Is there anything we can do for the person's space to make them feel more comfortable?
Definitely, one of the real important things is you want to keep them safe. You want to make sure the environment is safe. So simple things like the stove, you may have to unplug it every day when you leave and plug it back in when you're going to use it, just to keep that safe component. No clutter, the less clutter the better. A well-lit environment is really important. And less distractions, less noise. Things so simple as the television. You know, it's a great tool for distraction, but make sure when you have the TV on, it's something that they enjoy. You know, so often people will turn the TV on to a station that they like or the radio on a station that they like, and it's not what your family member with dementia might enjoy. So if they don't like golf, don't put golf on.
That's a really good point. Do you have any final advice for care partners out there?
Most importantly, I think they need to know they're not alone. You don't have to cope alone. There's help out there, and the Alzheimer's Society is a great resource, and I think you need to call them and you need to get that support and get information from them. But remember, you're a detective, and as a family member, you have to be flexible. You have to find those approaches that work, and what works today might not work tomorrow, or it might work this morning and not this afternoon. So that flexible part of it is really important. But get the support for yourself. I think that's so important.
Jeannine, those are some great tips. Thank you so much for this. I'm definitely going to use some of those when I spend time with my mother. Knowing how to find solutions will definitely help me. I hope that some of the things in this conversation will also help you.